Recently, new guidelines were released in regards of cholesterol treatment. In this next segment of Health Matters, we're going to speak to a board-certified cardiologist and lipidologist here at Florida Medical Clinic to find out more.
I am a non-invasive cardiologist with a specialty in cardiovascular prevention and lipidology. And that means cholesterol management and doing my very best to keep people out of the hospital.
What exactly is cholesterol?
Well, first let me say that people incorrectly believe that cholesterol is something bad, but in fact, cholesterol is very important. It's a fatty, waxy substance, and about 80% is indeed made by the liver, and 20% is dietary and comes in through the intestines. Now, it's packaged in a protein coat and it travels all over the body, and it's very important in cell membrane structure, and our body has trillions of cells. It's very important in hormone synthesis and also very important in bile synthesis. So bile is secreted in the intestines and is very important for digestion. But cholesterol can be harmful as well, and that's when it deposits in the arteries of the heart and the brain. And for some people, that can lead to heart attacks and strokes.
So how exactly do you decide who needs cholesterol treatment?
Well, we know that there are groups of people who are at high risk and who need treatment. For example, the diabetic. If you're diabetic, you're at significant risk for having a cardiovascular event. All diabetics need treatment. If you have known cardiovascular disease, so if you're a person who's had a stent, you may have had a heart attack already, you're at significantly high risk for a recurring event and you need treatment. So diabetics and those with established cardiovascular disease. There are many people who have a genetic basis for their problem, and they typically have very high LDL cholesterols greater than 190. We typically classify them as having a familial problem. We call it familial hypercholesterolemia. So these people with extremely high cholesterols are at high risk. They need to be treated. And there's a fourth group, and those are people that may look like you and me, but they have risk factors. So the new guidelines have developed what is called a cardiovascular risk calculator. So you place different features that people have into this calculator, and it will tell you who's at high risk and who needs to be treated.
Could you discuss the new guidelines that recently came out regarding cholesterol treatment?
What these new guidelines are wanting to tell us, and that is what is important, is heart risk. And that is the likelihood that a person has heart disease. And we know that people who have heart disease may have high numbers and low numbers, and they may be everywhere and anywhere. But more important is that we identify who has plaque. Plaque is dangerous. It's plaque which leads to cardiovascular events, and that we treat that person who has plaque. So the treatment may shrink the plaque, hopefully, stabilize plaque, prevent plaque rupture. And so the shift is away from the numbers. We're treating heart attack risk, and the numbers are now out of it. And that's a huge shift again, from everything that we know.
What is the recommendation for following up with cholesterol treatment?
Follow-up is in the normal, regular manner, regular visits, but no longer do we need to do lab tests. We don't need to measure the cholesterol levels anymore. They're regular visits. We want to monitor the administration of the therapies, that they're being taken and well tolerated. And what's important about that in the follow-up is that we do want to be on the lookout for those who may have problems with the medications. Many medications have side effects. The most important drug class in the treatment of this population of patients is the group of drugs called statin drugs. And those are drugs that inhibit cholesterol synthesis in the liver. They've been shown to have a very strong plaque stabilizing effect or anti-inflammatory, and have been proven to reduce the risk of cardiovascular events. And some of the common statins that we're familiar with are Crestor, Lipitor, and Zocor or simvastatin. And part of the best drugs to choose, and the statin therapies are the only proven drug class to reduce the risk, is the fact that we also need to give them in a very aggressive manner. So we don't have the numbers to look at anymore, but we know we need to intensify our therapies, and generally that means giving the drugs according to the evidence in the trials showing their benefit.
Why is someone's calcium score so important?
The calcium score is an extremely important test, and probably the best test and the most recommended test by the largest cardiology organizations. And it's not a blood test, but it's a CT scan of the heart that sees plaque. It sees plaque because plaque has calcium as part of its integral makeup. And so it takes a picture of the heart and it enables us to see if there's plaque. It enables us to see location and severity. So we can identify those who are at risk and who should be treated. So as a corollary, if there's somebody that you're concerned about because of family history or a blood test that they had and you did a calcium score and it showed no plaque, then you can tell that person that they do not need treatment.
For more information on Florida Medical Clinic, go to great38.com and click on Health Matters. Health Matters will be right back.